sides of the dorsal venous arch are continuing as cephalic vein on the lateral side and basilic vein on the medial side. Okay, we have already seen the dorsal venous arch. These are important surface landmarks on the dorsum. These are given for your surface marking. Okay, olecranon process, posterior border of ulna, styloid process of ulna, head of radius, styloid process of radius, dorsal tubercle of Lister. This is the dorsal tubercle of Lister. Okay, these are the styloid process, ulnar styloid process, radial styloid process, posterior border of ulna, olecranon process, head of radius, epicondyles, medial and lateral epicondyles of the humerus. Incision lines are given like this. One incision line is given joining the two epicondyles, another incision line joining the two styloid processes. Then a midline incision is given joining the midpoint of these two transverse incisions. Then we will reflect the skin and the superficial fascia. In the superficial fascia you will get those veins, cephalic and basilic, part of these veins. And then after that you will see the muscles. So these are the muscles. Okay. So muscles of the back of forearm are grouped into superficial muscles and deep muscles. So superficial muscles are again grouped in two divisions are there, lateral group and posterior group, like this you remember. Okay. So lateral group contains three muscles, Brachioradialis, Extensor Carpi Radialis Longus and Extensor Carpi Radialis Brevis. And posterior group contains these four muscles, Extensor Digitorum, Extensor Digiti minimi, Extensor Carpi ulnaris and the Anconeus. Okay, so these are the muscles of the posterior group. Next we are going to deep muscles. Deep muscles are the supinator, Abductor Pollicis Longus, Extensor Pollicis Brevis, Extensor Pollicis Longus and Extensor Indicis. These are the deep group of muscles. Okay, so see in these pictures, these are the superficial group, again divided into lateral group and posterior group. Lateral group, three muscles, here they are lying, Brachioradialis, Extensor Carpi Radialis Longus, Extensor Carpi Radialis Brevis. Okay. Posterior group, three muscles, Extensor Digitorum, Extensor Digiti minimi, Extensor Carpi ulnaris. Okay, those six muscles are included in the superficial group. Next they are going to deep group. You cannot see the supinator, it is lying around the head and neck of the radius. Okay, it is lying at a deeper plane. If you cut these muscles, then you will see the supinator. Deep group muscles visible here are the Abductor Pollicis Longus, Extensor Pollicis Brevis, Extensor Pollicis Longus and Extensor Indicis. Extensor Indicis is going to extensor index finger. Okay. So these are included in the deep group of muscles along with supinator. So these are the muscle bellies have been shown, Brachioradialis, Extensor Carpi Radialis Longus, Extensor Carpi Radialis Brevis, lateral group. Here is the posterior group, Extensor Digitorum, Extensor Digiti minimi, Extensor Carpi ulnaris. And here are the deep group, Abductor Pollicis Longus, Extensor Pollicis Brevis and Extensor Pollicis Longus. These two are forming lateral boundary of anatomical snuffbox, and this Extensor Pollicis Longus is forming the medial boundary of anatomical snuffbox. Okay, and these two tendons are lying in the floor, and in the floor lying the radial artery. Okay, of the anatomical snuffbox. Anatomical snuffbox is important for your theory also, comes as a short note. Okay. So this part is forming the anatomical snuffbox, and here is the Lister's tubercle. You have to remember this tendon of Extensor Pollicis Longus passes medial to this Lister's tubercle. Okay. Anatomical snuffbox. So we will discuss these muscles in details. Okay, all these muscles are larger muscles, can be given in your OSPI. You have to identify the muscle and have to know the origin, insertion, nerve supply and action of all these muscles. Okay. So first we are going to superficial muscles. Superficial muscles can be grouped as lateral and posterior group. So these are the muscle: extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris. These four are arising from the posterior surface of lateral epicondyle of humerus through a common extensor origin, and raised to brachioradialis and extensor carpi radialis longus. They were originating from the lower part of the supracondylar ridge. Okay, from the supracondylar ridge, lateral supracondylar ridge. And this one is Anconeus. This triangular muscle is Anconeus. It is a small triangular muscle located on the lateral side of the olecranon process. Anconeus means bend of elbow in Greek. And to visualize the Anconeus, you have to dissect out thick fossa covering this muscle. Where is the origin? Origin is from lateral epicondyle of humerus, and direction of fibers, the fibers run downward and medially. Okay, and it is inserted on the lateral surface of the olecranon process. This is the olecranon process of ulna. Innervation is by radial nerve. Nerve to Anconeus arise from the radial nerve in the spiral groove. Okay, the branch supplying the medial head of triceps was going to supply this Anconeus. We have already discussed. Next is the action. Action is extension of the elbow joint. Okay, this is the function. Here is the Anconeus, origin here in the lateral epicondyle of humerus. Insertion is here, lateral surface of the olecranon process of ulna. Next we are going to brachioradialis. This one is brachioradialis. Okay, origin is here, upper 2/3 of the lateral supracondylar ridge of humerus. Insertion into the styloid process of the radius. Okay, so brachioradialis is the fusiform muscle, lies on the anterolateral aspect of the forearm, and here it forms the lateral boundary of cubital fossa. Origin is from the upper 2/3 of lateral supracondylar ridge of humerus, and direction of fibers, the fibers form a muscle belly that produces bulging on the anterolateral aspect of upper part of forearm, and fibers overlap the radial nerve. Insertion is into lateral surface of radius just above the styloid process here. Innervation is radial nerve. Action, it is the muscle of extensor compartment of forearm that flex the elbow joint also. It brings the forearm to mid-prone position from supine or prone position. Okay, so this is the function. Brachioradialis, origin from upper 2/3 of lateral supracondylar ridge, insertion into lateral side of the distal end of radius. Mobile word of Henry. It is formed by three muscles that lie on the lateral aspect of the posterior compartment of forearm, and these muscles include the brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, and these muscles flex the elbow joint. Next we are going to next muscle, extensor carpi radialis longus. It is a long fusiform muscle, lies posterolateral to the brachioradialis, under cover of brachioradialis. Under cover of brachioradialis you will identify, okay, in the upper part of forearm. Origin is from the lower 1/3 of supracondylar ridge, from the upper 2/3 origin of brachioradialis, and lower 1/3 origin of the extensor carpi radialis longus. And direction of fibers form a belly under cover of brachioradialis and a slender tendon in the lower part. Here is the tendon. Insertion is into posterior surface of base of second metacarpal here, and innervation is radial nerve. Action is extension of the wrist joint along with the extensor carpi ulnaris, extensor carpi radialis brevis. An abduction at the wrist joint is caused by along with flexor carpi radialis, extensor carpi radialis brevis. Next is extensor carpi radialis brevis. It has a smaller belly, lies deep and posteromedial to extensor carpi radialis longus. Okay, so you will get on the superficially brachioradialis, deep to it extensor carpi radialis longus, deep to which will be extensor carpi radialis brevis. Okay, origin is from lateral epicondyle of humerus. Direction of fibers form small belly, long tendon, runs medial side of the extensor carpi radialis longus, inserted on the posterior surface of base of third metacarpal here, posterior surface of base of third metacarpal. Nerve supply is by posterior interosseous branch of radial nerve. Action is extension at the wrist joint along with ECRL and ECU, and abduction at the wrist along with extensor carpi radialis, extensor carpi radialis longus. Okay. So these are the origin of these muscles. Here is the insertions. Base of second metacarpal, base of third metacarpal. Okay, understood. ECRL, ECRB. So the tendon of extensor carpi radialis longus and brevis are crossed by the abductor pollicis longus and extensor pollicis brevis above the wrist, and the tendons of ECRL and ECRB passes behind the styloid process of radius deep to the extensor retinaculum, and near the insertion the tendons of extensor carpi radialis longus and extensor carpi radialis brevis are crossed by tendons of extensor pollicis longus. You have seen in this diagram of anatomical snuffbox, those abductor pollicis longus, extensor pollicis brevis and this extensor pollicis longus all were crossing this insertion of this ECRL and ECRB. Next we are going to extensor digitorum. It has a bulky belly here. This is extensor digitorum. In the flexor compartment you have got two digitorum, flexor digitorum superficialis, flexor digitorum profundus. Here in extensor compartment only one digitorum is there, extensor digitorum. Okay. Origin from lateral epicondyle of humerus and direction of fibers. Fibers form a bulky belly that form four tendons in the lower part of forearm, and the tendons pass deep to the flexor retinaculum, spread out on the dorsum of the hand. Insertion is on the one tendon reaches each of the four medial fingers, and it inserts on the bases of medial and distal phalanx through dorsal digital expansion. Innervation by posterior interosseous nerve, and action is extension of the medial four fingers and extension of the wrist. See here, this is the tendon of extensor digitorum. It is forming the dorsal digital expansion, triangular expansion, and this apex is divided into three slips. One central slip inserted into base of the middle phalanx and two lateral lips inserted on the again joining to form a single slip inserted into the base of the distal phalanx. And you can see on the two sides the interossei, palmar and dorsal interossei and lumbricals are getting insertion. Okay. So tendons of extensor digitorum and extensor indicis passes together deep to the flexor retinaculum along with posterior interosseous nerve and the anterior interosseous artery. So in this compartment lies the neurovascular bundle of the posterior compartment, okay, along with the extensor digitorum and extensor indicis. Next is extensor digiti minimi. Extensor digiti minimi is also called extensor digiti quintiproprius. Okay, it is small slender muscle lies on the medial side of the extensor digitorum. So দেখ ওখানে ছবিতে দেখ extensor digitorum. Origin is from lateral epicondyle of humerus, insertion into extensor expansion of the little finger. Innervation is by posterior interosseous branch of radial nerve, and action is extension of the metacarpophalangeal joint of the little finger. Okay. Next is extensor carpi ulnaris. It is the medialmost long muscle of the posterior compartment of forearm. Where is the origin? Lateral epicondyle of humerus, common extensor origin. Direction of fibers, fibers converge to form a tendon, passes behind the ulnar styloid process deep to the flexor retinaculum, inserted into the base of the fifth metacarpal. Innervation is by posterior interosseous branch of radial nerve. Action is extension of the wrist along with the ECRL and ECRB. Okay. And adduction of the wrist is done along with flexor carpi ulnaris. This is one clinical aspect, mallet finger, okay, comes in your explain why or short note, mallet finger. If a ball or object hits the distal phalanx, there will be injury to the extensor tendon. There is tearing of the tendon, you can see there, and inability to extend the distal interphalangeal joint because of tearing of the tendon, and this is known as mallet finger. Okay, understood? Next we are going to deep muscles. Deep muscles are these 5: supinator, abductor pollicis longus, abductor extensor pollicis brevis, extensor pollicis longus, and extensor indicis. See those muscles, location of the muscle, their origin: abductor pollicis longus, extensor pollicis brevis, below it extensor indicis. Okay, and those are the insertion: abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus. Okay, those are the insertion. Pollicis means it will go to the thumb. Yes, to the superficial extensor muscles, and tendon crosses brachioradialis and emerges to form the boundary of anatomical snuffbox. And origin is from posterior surface of ulna, posterior surface of interosseous membrane, posterior surface of radius. And direction of fibers, the muscle fibers run obliquely downward and laterally, and its tendon runs deep to the extensor retinaculum on the lateral side of lower end of the radius along with the extensor pollicis brevis. Insertion is into the lateral side of base of first metacarpal. Innervation is by posterior interosseous nerve. Action is abduction of the thumb. And clinical testing is done. You have to ask the patient to abduct the thumb against resistance. Okay. So this is abduction. Abduct the thumb against resistance, and tendon of abductor pollicis longus becomes prominently visible on the lateral side of the anatomical snuffbox. Here is the anatomical snuffbox. Okay, so on the lateral side of snuffbox, here is the abductor pollicis longus. See the different compartments and containing different muscles. 6 compartments are there, okay, containing all these tendons of all these muscles. First compartment from lateral to medial we are counting, okay. Lateral most compartment contains 2 muscles, abductor pollicis longus, extensor pollicis brevis. Second compartment contains 2 muscles, extensor carpi radialis longus, extensor carpi radialis brevis. Third compartment contains 1 muscle, extensor pollicis longus. Fourth compartment contains 2 muscles, 4 tendons of extensor digitorum along with extensor indicis and the neurovascular bundles, posterior interosseous nerve and anterior interosseous artery. Next compartment contains a single muscle, extensor digiti minimi, and 6th compartment single muscle, extensor carpi ulnaris. Okay, all these compartments you have to know, lying on the posterior aspect of the wrist. So extensor pollicis brevis is the abductor pollicis longus we have discussed. Next we are going to extensor pollicis brevis. It is a fusiform muscle covered by the superficial extensor muscles. Origin is from posterior surface of radius below the origin of abductor pollicis longus, and adjoining posterior surface of interosseous membrane, and direction of fibers, the muscle runs obliquely downward to follow the course of abductor pollicis longus. This is abductor pollicis longus, here is extensor pollicis brevis, extensor indicis. Indicis is going to index finger and these 2 pollicis are going to thumb, okay. And direct insertion into the dorsal surface of base of proximal phalanx of thumb, here extensor pollicis brevis, okay. Innervation is posterior interosseous nerve. Action is extension of proximal phalanx and metacarpal of the thumb. How will you test this muscle? Ask to extend the metacarpophalangeal joint of thumb against resistance and feel the prominent extensor pollicis brevis forming lateral boundary, radial boundary of the snuffbox. Okay, this is extension. So you have to do the extension against resistance and this muscle will be prominent. Now, below the origin of the extensor pollicis longus, posterior surface of interosseous membrane, Direction of fibers, it is a small fusiform muscle. Tendon lies deep to the extensor digitorum while passing through the extensor retinaculum. Okay, so on the dorsum of the hand, its tendon lies on the medial side of tendon of the extensor digitorum for the index finger. Insertion is over the extensor expansion of the index finger. Nerve supply is posterior interosseous nerve. Action is isolated extension of metacarpophalangeal joint of index finger. Okay. So here are those nerve of this compartment is posterior interosseous nerve. This supinator muscle have been shown here, supinator, okay. This is abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis, digitorum, extensor digiti minimi, extensor carpi ulnaris. All those are supplied by this posterior interosseous nerve, okay. Okay, so extensor pollicis longus, it is larger and longer than the extensor pollicis brevis. Origin is from the posterior surface of ulna below the origin of abductor pollicis longus and posterior surface of interosseous membrane. Direction of fibers form is fusiform belly and coverage on a long tendon. Passes on the medial side of the posterior tubercle of radius, Lister's tubercle. This point you remember, okay, to identify this muscle. Extensor pollicis longus passes medial to the Lister's tubercle and it helps to change the direction of pull of the muscle. Inserted into posterior aspect of base of distal phalanx of thumb. Innervation by posterior interosseous nerve. Action is extensor of the distal phalanx of thumb and extensor of proximal phalanx of thumb and first metacarpophalangeal joint. Next is supinator. Here is the supinator. It is the broad sheet like muscle, covers the upper part of the radius. Origin is from the humerus, lateral epicondyle of humerus, an annular ligament of the superior radioulnar joint. Okay. And ulna from the ulna supinator crest, triangular area in front of the supinator crest. And direction of fibers wind around the radius, spiral course is there and fibers are arranged into superficial and deep layer, and deep branch of radial nerve passes downward between these two layers, okay. The posterior interosseous nerve, it is formed by the deep branch of radial nerve after piercing through this supinator, okay. Insertion, radius, upper 1/3 of posterior, lateral and anterior portion of the radius. Innervation is posterior interosseous nerve, action is supination of the forearm. Supinator can supinate the forearm in all the positions of the elbow, but biceps brachii can supinate only in mid-flexed elbow position, okay. That is the difference between biceps and supinator. So these are the deep muscles, you have to know the origin, insertion. Nerve supply is same, posterior interosseous nerve and action, okay. Extensor retinaculum, this white band like structure you can see, that is the extensor retinaculum, and from it extensions are going towards to be attached to the bone and dividing the tendons into 6 compartments. We have already discussed those 6 compartments. Here are the compartments and their muscles have been shown, okay. This schematic diagram you practice for those compartments, it can come in your theory. Our nerve is the posterior interosseous nerve, we have already discussed with the radial nerve, and artery is the posterior interosseous artery. Posterior interosseous artery is the main artery of the posterior compartment of forearm, and it is a branch from common interosseous artery, which is a branch of ulnar artery, okay. Of course, it arises in the cubital fossa, soon enters the posterior compartment of the forearm by passing through the gap between the oblique cord and upper margin of interosseous membrane, and it passes between the supinator and abductor pollicis longus accompanied by the posterior interosseous nerve, terminates by anastomosing with the anterior interosseous artery in the lower part of the forearm. and branches, it supplies the muscles of back of forearm, and interosseous recurrent artery that forms the anastomosis around the elbow. Okay. So, this is the posterior interosseous nerve in summarization. Deep branch of radial nerve pierces supinator, lies between the superficial and deep extensor muscles. Before supinator, it is supplying ECRB and supinator. In the supinator, it is supplying only the supinator. After emerging from the supinator, supplying all the rest of the superficial and deep muscles of the posterior compartment. And this is anatomical snuffbox. You can see the boundary. Laterally, it is bounded by the tendons of Abductor Pollicis Longus, Extensor Pollicis Brevis. Medially bounded by the Extensor Pollicis Longus. Content is the radial artery. You can see the radial artery, and floor is formed by two bones, scaphoid and trapezium. Okay, and in the roof lies the skin and superficial branch of radial nerve and the cephalic vein. Okay. So, these are the boundaries of anatomical snuffbox. You prepare this, you practice a diagram and prepare as a short note. Okay, understood? Okay, so posterior interosseous nerve can come as a short note, anatomical snuffbox is a short note. Okay, and rest is important for your practical. Okay, and those compartments you practice as a short note. 6 compartments on the back of the wrist under cover of the extensor retinaculum. Okay, understood?